First at 6, an Indianapolis woman is dead after traveling to the Dominican Republic for plastic surgery. It is a growing trend. U.S. citizens leaving the country to get those procedures.
And WRTV's Adam Shooms and photojournalist Paul Chiodo have been working this week to try to find out what went wrong in the Dominican Republic.
With a heavy heart, Sheree Terry reflects on the life of her twin sister.
And she went to go get her body done in a DR. And she never made it back.
SHACARE Terry was a mother to a 2-year-old and the proud owner of the Mini Blessings in Paradise daycare on the city's east side before going to the Dominican Republic.
And me and my sister had the type of relationship where we could get into it 1 minute. And then right after that, we'll be back friends and talk. And so I knew someone right. I felt it in my heart. And I've been just trying to get help.
This wasn't SHACARE's first surgery this year. She posted on her Facebook back in February that she got surgery. Her family says it was a gastric sleeve surgery that she got in Mexico. Just a few months later, on April 11th, her family says SHACARE went with her friend Carlisha Williams to the Dominican Republic.
So she definitely was healthy. Everything went wrong. It happened there.
They both had surgery for a Brazilian butt lift and a tummy tuck. They say the surgery was performed by Dr. Jose DeSena, seen here before the surgery.
But after she called me Thursday night, she just wasn't right.
The second day into recovery, which was Friday, the 15th, SHACARE I was, moving around a lot more. And SHACARE, I was still in pain, but I was moving around. SHACARE wasn't really moving around. She wasn't doing nothing. She would lay in bed. I would go in there and try to get her out the bed, try to get her to come downstairs and eat with me, and she just wasn't responding well.
Carlisha says SHACARE was moved from their recovery house and admitted to a clinic in Santiago.
When we go in there and I see SHACARE, I almost fell out. Like literally, like she was on all these machines. She was unresponsive. And she wasn't talking, wasn't alert, eyes closed. She's unresponsive.
Carlisha Williams was told that SHACARE was okay. Her kidneys were doing well and her body needed rest. Carlisha says Dr. DeSena said she was only sedated.
So I'm like, so if you unhook that, she'll be able to breathe and stuff like that on her. He was like, oh, yeah, she's perfectly fine. Like, her body just needs rest.
Carlisha says she went back to see SHACARE the next day and a different doctor was there. According to Carlisha, that doctor told her SHACARE was having a hard time breathing on her own. But 20 minutes later, she says Dr. DeSena came in and told her SHACARE was getting better and just needed dialysis.
I reach out to the mother and, I'm telling them what's going on, but I'm trying not to scare them. But at this point, I want to scream, like, get down here, like.
When SHACARE's mom arrived about a week after the surgery, Carlisha says the doctors continued to say that SHACARE just needed rest and they were told to leave. Carlisha was set to come back to Indiana the next day.
Her mother's talking to her. Her mother, basically, she tells me, like, Carlisha, I don't believe my daughter is alive. She was like, I know my daughter isn't alive. Why won't they tell me?
By the time she got to Indiana, Carlisha said that she was notified that SHACARE had passed away.
So she was like, Carlisha, I went back to my room. She was like, I was probably there for about an hour. She was like, they called me and told me SHACARE's heart stopped just that quick. I said, huh? She said, as soon as she went in, she said her daughter was already in a body bag that quick.
Sheree and Carlisha say they just want answers. I reached out to the State Department. They said they can confirm the death of a U.S. citizen in the Dominican Republic, and they're providing all appropriate assistance to the family.
We're going to keep fighting. We will not stop at all. SHACARE was a very important person.
Working for you, Adam Shooms, WRTV.
Well, we have made numerous attempts to contact Dr. Jose DeSena in the Dominican Republic. He has not responded to any of our requests. We will keep trying to reach him, however.
And tonight, the family tells us after trying for days, they expect SHACARE's body back in the U.S. tomorrow. There will be a balloon release for SHACARE Terry happening this Saturday at 4 p.m.
This will be at 5417 East 38th Street on the northeast side of Indianapolis, and we do want to pass along the public is welcome to attend. WRTV reached out to a doctor who specializes in plastic and reconstructive surgeries for Eskenazi, Methodist, and IU Health. He said traveling overseas for plastic surgery is a growing trend.
Dr. Ivan Haddad said since last summer he has seen at least one patient a week at his practice at Eskenazi who had previously left the country for plastic surgery. He said some had complications from those overseas surgeries and some did not.
I would say it's like 50-50 in that there's a number of patients that, had the operation that they wanted and had a adequate result. But then, it's basically a coin flip where the others, had, have some complications, some that are, expected, some that are not, or the result wasn't what they expected.
Dr. Haddad said fairly often he sees patients that have traveled to another country for surgery. So before you get any kind of procedure here in Indiana, you can look up a doctor and check out their qualifications, disciplinary history, and any claims of malpractice. Just go to the state's website, in.gov, and find the Medical Licensing Board of Indiana section. Once you are there, scroll down to the consumer patient information. We will have a link to that site in our story at WRTV.com.